Hello guys and welcome back to my channel. In this video we'll be learning about the hip joint.
The hip joint is a ball and socket variety of synovial joint. It is formed by the articulation of the acetabulum of the hip bone medially and the head of the femur laterally. Medially means towards the body and laterally means away from the body. The head of the femur forms more than half of a sphere and it is covered by hyaline cartilage except at the fovea capitis. The acetabulum, as you can see right here, presents a horseshoe shaped lunate articular surface, an acetabular notch and an acetabular fossa. Now looking at the features of the hip joint with the help of this specimen, we can see that the hip joint is a ball and socket variety of synovial joint. The articular surfaces are the acetabulum of the hip bone and the head of the femur, as you can see right here. They articulate in this manner. The head of the femur forms more than half of a sphere. It is covered with hyaline cartilage except at the fovea capitis. The acetabulum presents a horseshoe shaped lunate articular surface, as you can see right here, an acetabular notch and an acetabular fossa. The hip joint is unique in having a high degree of stability and mobility. The stability or the strength of the hip joint depends upon 5 factors. First is the depth of the acetabulum. Second is the tension and strength of the ligaments. Third is the strength of the surrounding muscles. Fourth is the length and obliquity of the neck of the femur. And finally, fifth is the atmospheric pressure. Now, concising the main points of the introduction to the hip joint, we have the hip joint is a ball and socket variety of synovial joint. Its articular surfaces are that the joint is formed by the articulation of the acetabulum of hip bone medially, the head of the femur laterally. The head of the femur forms more than half of a sphere. It is covered with hyaline cartilage except at the fovea capitis. The acetabulum presents a horseshoe shaped lunate articular surface, an acetabular notch and an acetabular fossa, as you can see right here. The acetabular fossa, the lunate horseshoe shaped lunate articular surface and the acetabular notch. Next, the hip joint is unique in having a high degree of stability as well as mobility. The stability or the strength depends upon the depth of the acetabulum, the tension and strength of the ligaments, the strength of the surrounding muscles, the length and obliquity of the neck of the femur and the atmospheric pressure. Moving on to the ligaments of the hip joint, we have 7 main ligaments. First is the fibrous capsule, the iliofemoral ligament, pubofemoral ligament, the ischiofemoral ligament, the ligament of the head of the femur, the acetabular labrum and the transverse ligament of the acetabulum. Now let's look at each of these ligaments in detail. Firstly, we have the fibrous capsule. The fibrous capsule is attached on the hip bone right here. It is attached to the acetabular labrum here as well as to the bone above and behind the acetabulum, as you can see right here. It is attached on the femur to the intertrochanteric line in front and 1 cm medial to the intertrochanteric crest behind. It is attached on the femur to the intertrochanteric line in front right here and 1 cm medial to the intertrochanteric crest behind, that is right here. The capsule is made up of 2 types of fibers. The outer fibers are longitudinal, the inner ones are circular and are called zona orbicularis. The longitudinal fibers are best developed anterosuperiorly, that is anteriorly and superiorly right here, where many of them are reflected along the neck of the femur to form retinacula. The blood vessels supplying the head and the neck of the femur travel along these retinaculae. The synovial membrane, as you can see right here, lines the fibrous capsule, the intracapsular portion of the neck of the femur, both surfaces of the acetabular labrum, the transverse ligament and the fat in the acetabular fossa. The joint cavity communicates with the bursa lying deep to the tendon of the psoas major through a circular opening in the capsule located between the pubofemoral ligament and the iliofemoral ligament, as you can see right here. This is the synovial bursa. Now, concising the main points under the fibrous capsule, it is attached on the hip bone to the acetabular labrum, including the transverse acetabular ligament, to the bone above and behind the acetabulum. It is attached on the femur to the intertrochanteric line in front and 1 cm medial to the intertrochanteric crest behind. The capsule is made up of two types of fibers. The outer fibers are longitudinal, the inner circular ones are called zona orbicularis. The longitudinal fibers are best developed anterosuperiorly, where many of them are reflected along the neck of the femur to form retinacula. The blood vessels supplying the head and the neck of the femur travel along these retinacula. The synovial membrane lines the fibrous capsule, the intracapsular portion of the neck of the femur, both surfaces of the acetabular labrum, the transverse ligament, the fat in the acetabular fossa. Finally, the joint cavity communicates with the bursa lying deep to the tendon of psoas major through a circular opening in the capsule located between the pubofemoral ligament and the iliofemoral ligament. Moving on to the next ligament, we have the iliofemoral ligament right here. It is an inverted Y-shaped ligament called the ligament of Bigelow. It lies anteriorly. It is one of the strongest ligaments in the body. It prevents the trunk from falling backwards in the standing posture. The ligament is triangular in shape. Its apex is attached to the lower half of the anterior inferior iliac spine. The base is attached to the intertrochanteric line of the femur, as you can see right here. The upper oblique and lower vertical fibers form thick and strong bands, while the middle fibers are thin and weak. Now, concising the important points under the iliofemoral ligament, it is an inverted Y-shaped ligament of Bigelow which lies anteriorly. It is one of the strongest ligaments in the body. It prevents the trunk from falling backwards in the standing posture. The ligament is triangular in shape. Its apex is attached to the lower half of the anterior inferior iliac spine. Its base is attached to the intertrochanteric line. The upper oblique and lower vertical fibers form thick and strong bands, while the middle fibers are thin and weak. Next, we have the pubofemoral ligament right here. It supports the joint infromedially, that is, inferiorly and medially towards the body. It is also triangular in shape. Superiorly, it is attached to the iliopubic eminence, the obturator crest and the obturator membrane. Inferiorly, it merges with the anteroinferior part of the capsule and with the lower band of the iliofemoral ligament, as you can see right here. This is a pubofemoral ligament. Now, concising the main points under the pubofemoral ligament, it supports the joint infromedially. It is also triangular in shape. Superiorly, it is attached to the iliopubic eminence, the obturator crest and the obturator membrane. Inferiorly, it merges with the anteroinferior part of the capsule and with the lower band of the iliofemoral ligament. Moving on to the ischiofemoral ligament, it is a comparatively weak ligament. It covers the joint posteriorly. Its fibers are twisted and extend from the ischium to the acetabulum. The fibers of the ligament form the zona orbicularis. Concising the main points under the ischiofemoral ligament, it is a comparatively weak ligament. It covers the joint posteriorly. Its fibers are twisted and extend from the ischium to the acetabulum. And finally, the fibers of the ligament form the zona orbicularis. Next, we have the ligament of the head of the femur that you see right here. It is also called the round ligament or the ligamentum teres, which is a flat and triangular ligament. The apex is attached to the fovea capitis right here, and the base is attached to the transverse ligament and margins of the acetabular notch right here. It may be very thin or even absent. Now looking at the main points, the round ligament or ligamentum teres is a flat and triangular ligament. The apex is attached to the fovea capitis, the base is attached to the transverse ligament and the margins of the acetabular notch. It may be very thin or even absent. Next we have the acetabular labrum. It is a fibrocartilaginous rim attached to the margins of the acetabulum, as you see right here. It narrows the mouth of the acetabulum. This helps in holding the head of the femur in position. The acetabular labrum is a fibrocartilaginous rim attached to the margins of the acetabulum. It narrows the mouth of the acetabulum. It helps in holding the head of the femur in position. Finally, we have the transverse acetabular ligament. This is the acetabulum. This is the lunate surface. This is the acetabular fossa, and this is the acetabular notch, which is occupied by the transverse acetabular ligament. It is a part of the acetabular labrum, which bridges the acetabular notch, as you can see right here. The notch is then converted into a foramen, which transmits acetabular vessels and nerves to the joint. This is the acetabular notch of the acetabulum of the hip bone. The transverse ligament of the acetabulum bridges the acetabular notch like this. The notch is then converted into a foramen, which transmits acetabular vessels and nerves to the joint. The transverse ligament of the acetabulum is a part of the acetabular labrum, which bridges the acetabular notch. The notch is then converted into a foramen, which transmits the acetabular vessels and the nerves to the joint. Now let's look at the relations of the hip joint. The anterior relations are the tendon of the iliopsoas that you see right here, which is separated from the joint by a bursa called the synovial bursa, and the femoral nerve, the femoral artery and the femoral vein. The posterior relations are the piriformis muscle, the sciatic nerve, the obturator internus and gemelli, the quadratus femoris muscle and the gluteus maximus. The superior relations include the reflected head of the rectus femoris muscle, which is covered by the gluteus minimus, gluteus medius and partly by the gluteus maximus. And finally, the inferior relations include the lateral fibers of the pectineus muscle and the obturator externus muscle. Now, concising the relations of the hip joint, in the anterior relations we can see the tendon of the iliopsoas separated from the joint by a bursa and femoral vein, femoral artery and femoral nerve. The posterior relations include the joint posteriorly is related to the following muscles. The tendon of the obturator externus covered by the quadratus femoris, the obturator internus and gemelli, the piriformis muscle, the sciatic nerve and the gluteus maximus. Now the superior relations include the reflected head of the rectus femoris covered by the gluteus minimus, gluteus medius and partially by the gluteus maximus muscle. The inferior relations include the lateral fibers of the pectineus and the obturator externus. Moving on to the blood supply, the hip joint is supplied by the obturator artery that you see right here, two circumflex femorals, that is the medial circumflex femoral artery and the lateral circumflex femoral arteries, as you can see right here and right here, and the two gluteal arteries, that is the superior gluteal artery and the inferior gluteal artery. The medial and lateral circumflex femoral arteries form an arterial circle around the capsular attachment of the neck of the femur. A part of the head near the fovea capitis is supplied by the acetabular branches of the obturator artery and the medial circumflex femoral artery, right here and right here. Concising the three main points under the blood supply, the hip joint is supplied by the obturator artery, two circumflex femorals and two gluteal arteries. The medial and lateral circumflex femoral arteries form an arterial circle around the capsular attachment on the neck of the femur. Finally, a part of the head near the fovea capitis is supplied by the acetabular branches of the obturator and medial circumflex femoral arteries. Moving on to the nerve supply, the hip joint is supplied by the femoral nerve, the anterior division of the obturator nerve, the nerve to the quadratus femoris, and the superior gluteal nerve. This is the femoral nerve, this is the obturator nerve. Moving on to the movements of the hip joint, the flexion and extension occur around a transverse axis. Adduction and abduction occur around an antero-posterior axis. Medial and lateral rotation occur around a vertical axis, while the circumduction is a combination of these three foregoing movements. This is the flexion of the hip and this is the extension of the hip. This is the abduction of the hip and this is the adduction of the hip. This is medial rotation and this is lateral rotation of the hip. Hip joint extension with slight abduction and medial rotation is the closed pack position for the hip joint, which means the ligaments and capsules are the most taut in this position. The hip joint extension, abduction and medial rotation is the closed pack position of the hip joint. The ligaments and capsules are most tight in this position. The surfaces are most congruent in slightly flexed, abducted and laterally rotated position of the hip. The articulating surfaces are most congruent in the slightly flexed, abducted and laterally rotated position of the hip joint. All axes pass through the center of the head of the femur, but none of them is fixed because the head is not spherical. Flexion is limited by the contact of the thigh with the anterior abdominal wall. Adduction is limited by contact with the opposite limb. Extension has 15 degree of range of motion. Abduction has 50 degree. Medial rotation has 25 degrees and lateral rotation has 60 degrees. The flexion movement is limited by the contact of the thigh with the anterior abdominal wall, while the adduction movement is limited by the contact with the opposite limb. The movement of the hip is closely related to the position of the knee because of the presence of two muscles which act on both the hip and the knee. In the extended position of the knee, the stretch on the hamstring muscles do not allow the hip to move in full flexion range. With knee completely flexed, hip joint may not attain complete extension due to tension in rectus femoris, which gets stretched at the hip and the knee. The movement of the hip is closely related to the position of the knee because of the presence of two muscles which act both on the hip and the knee. In the fully extended position of the knee, the stretch on the hamstring muscle do not allow the full movement of the hip flexion. When the knee is completely flexed, the hip joint may not attain full extension due to the stretch on the rectus femoris muscle both on the hip and the knee. Next, let's look at the muscles producing the movement at the hip joint. First, in flexion, the chief muscles are psoas major and iliacus. The accessory muscles include the pectineus, the rectus femoris and the sartorius. This is the anterior superficial view of the right lower limb. This is the psoas major. Here is the iliacus muscle. Here is the pectineus muscle. This is the sartorius muscle and this is the rectus femoris muscle. In extension movement, the chief muscles are gluteus maximus and the hamstrings. This is a posterior superficial view of the right lower limb. This muscle is the gluteus maximus. These are the hamstrings, which include the semitendinosus, the semimembranosus, the biceps femoris and the adductor magnus. In adduction, the chief muscles are adductor longus, adductor brevis and adductor magnus, while the accessory muscles are the pectineus and the gracilis. This is the adductor longus, this is the adductor magnus muscle, this is the adductor brevis, this is the gracilis muscle and finally This is the pectineus muscle. This is the anterior intermediate view of the right lower limb. In abduction, the chief muscles are gluteus medius and gluteus minimus, while the accessory muscles are the tensor fasciae latae and sartorius. This is the gluteus medius and this is the gluteus minimus. This is the tensor fasciae latae and this is the sartorius muscle from the lateral superficial view of the right lower limb. In medial rotation, the chief muscles are the tensor fasciae lata and the anterior fibers of the gluteus medius and gluteus minimus. And finally, in lateral rotation, the chief muscles are the two obturators, two gemelli and the quadratus femoris, while the accessory muscles are piriformis, the gluteus maximus and the sartorius muscle. This is the lateral deep view of the right lower limb, and this muscle is the quadratus femoris. This is the lateral intermediate view of the right lower limb, and this is the piriformis muscle. Finally, let's look at the clinical anatomy of the hip joint. Congenital dislocation is more common in the hip. The head of the femur slips upwards onto the gluteal surface of the ilium because the upper margin of the acetabulum is developmentally deficient. This causes a lurching gait and Trendelenburg's test is positive. Second is the Perthes disease or pseudocoxalgia, which is characterized by destruction and flattening of the head of the femur with an increased joint space in the X-ray. Disease of the hip like tuberculosis may cause referred pain in the knee because of the common nerve supply of the two joints. Finally, Shenton's line in an X-ray picture is a continuous curve formed by the upper border of the obturator foramen and the lower border of the neck of the femur. In fracture neck femur, the line becomes abnormal. So, the four clinical anatomy conditions are congenital dislocation, Perthes disease, tuberculosis and Shenton's line.
I hope you found this video helpful. To get updates on my latest videos, click on the subscribe button. To get notifications, tap on the bell icon. Thank you for watching.